technical, and running shoe stores now have become very savvy in terms of how to fit a shoe. Within our practice, we do video assessments that also help kind of identify and tweak some of the nuances of a person's gait. So when it comes to picking a shoe, we can help them do that, as well as if there's an orthotic that needs to be prescribed, we can also develop that as well.
Okay. You had mentioned before the show about that video gait analysis, and your practice sort of specializes in, athletes and runners, and so these are more intense sort of patients, and they don't want to hear advice from their doctor that go to physical therapy, you'll be better in 6 months when the marathon's in 4 months,
right.
or something like
Absolutely.
that. So you've got to be a little bit more aggressive in your treatment, and you offer specialty kind of preventive and diagnostic tools for them too, right?
That's correct.
Tell me about the video gait analysis, because that was kind of cool.
Video gait basically uses a video camera. We have a HD camera and a treadmill setup, and then we have a monitor that actually shows the running patterns. So we can actually do a slow motion evaluation, taking each step, right foot, left foot, and actually slowing it down to the point where you're actually seeing the heel strike, the midfoot position, and then toe off. And from those, you can actually see also strengths and weaknesses. So maybe somebody has a stronger hip on one side or a weaker hip on the other side. You can actually start looking at how the chain works. So that whole foot bone's connected to the ankle bone, to the knee bone, does take effect when you start breaking down the video analysis. And our video analysis also encompasses with some of our physical therapy groups that do a little bit more three-dimensional views, so side view, front view, and kind of take it to the next level. So,
have you ever been able to look at a film of somebody and tell them sort of a corrective measure that's improved their running?
We have. There's some new running techniques, and we didn't talk about this earlier, but there's some new running techniques that apply body positioning and form into the way that you run. So instead of the kind of fallback, which has been heel strike running, where you kind of drive the heel in and you push off the toes, you're using more of a midfoot or toe off position, so that you're letting the forward lean of your body take the momentum and draw you forward. So instead of stopping motion, which taking your heel and driving it into the ground is almost like hitting the brakes, you're actually propelling the person forward by changing the position of maybe their shoulders, hips, and knees, and the position then of their foot, so they're not overstriding or overstriking on the heel. So it does actually become more apparent when you do a video assessment, because you can see how they're landing, and certainly the position of where their shoulders and hips and knees are in the same process.
Yeah, that's interesting, the way they see everything that's connected, and what's happening on the ground affects other parts of their body.
Absolutely, sure.
Now you've given talks to marathon training groups like the Chicago Area Runners Association, and you've sort of helped some of these people out too, right?
Absolutely. Yes.
When you talk to these folks, and probably from the day you show up and talk to them, probably 70 or 80% of them already have foot pain because they've already been running. So what kind of solace or advice can you provide a group of people that are already probably experiencing intense and chronic foot pain, and are still committed to training for 3 or 4 more months for a marathon?
Yeah, it's interesting. When you give the talks, people tend to migrate to you. You know who the people are that have foot pain, because they're all kind of locked in on what you're saying. And you end up having to kind of cater a little bit to what the crowd is looking for. So probably the biggest question that we get is, I've trained all winter long. I've run up to 6 miles on a treadmill, and I get out and I'm starting to run on pavement when it starts to get warm out. The springtime, it's maybe 55 degrees out. They're running in shorts, and they just don't feel like they've run that far. And there is an equation that you actually have when you're running on a treadmill. That, say for example, if you run 10 miles on a treadmill, it equates to about 7 miles outside.
Really?
So you subtract about 30% of that mileage off, because the friction's different. When you're running on a treadmill, there's a belt that goes around and around and around.
That's helping you?
It helps you kind of move the legs and keep the legs moving. Well, outside, you don't have that luxury. You have friction of the pavement, you have hard surface. It's a lot more taxing on the body, so you end up having much more cardiovascular workouts with a outdoor run that's not accounted for when you're running on the treadmill. So we see a lot of that actually this year in particular, because it's so cold out, during the winter time, and then all of a sudden it's that season. They think that they're conditioned, but really when it comes down to it, they're not, and they have to kind of back off that training program a little bit to kind of pick themselves back up again.
And there's more pain when your foot hits a concrete cement versus a treadmill. That's a far different sort of act of physics there, isn't it?
Absolutely. About 4 to 5 times your body weight goes into each step when you're running, versus on a treadmill it's going to be a little bit less, probably about 3 to 3.5 times your body weight. And the jolting of the joints definitely is taken up more by the flexing deck of a treadmill versus, again, a hard pavement. So definitely a difference.
Have you ever encountered sort of a newbie group of runners that they've been untainted by chronic injuries, and you get them at sort of an introductory level where you can actually make a difference in terms of prevention?
Yeah, and that's the beauty of it. I mean, we'd love to, we see a lot of injuries, and unfortunately that's the case of our practice. We like to see the people also as preventative measure patients, getting them into running and then getting through a program. National AIDS Marathon, for example, is one of those programs that comes to mind. They do a run-walk program. So they do kind of an interval type of running where they do maybe like a 4-minute run and then a 1-minute walk, and they kind of interchange kind of, the run to walk to get through basically a marathon. So they do 26.2 miles with this run-walk program, and their, I don't want to say motto, but their kind of feeling is that anybody can run a marathon, and you can come off and, off the couch, hit our program and actually get through this program without having, to know how to run. And there are a lot of people who've gone through that, and again, they're driven by this charity, but in the same note, they want to run pain-free. So the run walk gives them a little bit of a recovery in between the time that they're running, and they are able to maintain a nice pace to get through. It's really interesting how they're able to do that.
And from your perspective, the injuries these people experience are far less significant than?
I'd say that they're less. They're not running necessarily straight through. So again, the time off that they're having from in between the runs, maybe in a minute or 2 minutes that they're walking, they're able to catch their breath. They're able to grab a water from the water station and kind of propel themselves forward. So you'll see some of the run walkers actually surpassing some of the people who have run all the way straight through and then hit the wall, which is typically about 18 to 20 miles. They come to a dead stop, and these people who are doing the run walk are kind of making their way past. It's almost the turtle in the hare type of analogy. So,
are there tips that you could pass on to new runners or new walkers from experienced people that have made mistakes or done things in a less than preventive way or a less gradual way? It's very common for people to get all excited about running a marathon and just, go out and, try and blow through 8 or 9 miles the first weekend. And, that usually comes back to hurt them. But are there tips that you can pass on from people that